Gentlemen, as we age, our bodies whisper to us before they scream, and when it comes to your penis, yes, your most private part, it deserves proper care, not embarrassment or silence. I'm a urologist, and today I want to have a real, respectful conversation with you, because your comfort, confidence, and health matter more than ever, especially now in your 60s and beyond. If you've ever wondered, am I doing enough to care for myself down there? This video is just for you. Taking good care of your penis starts with something very simple, yet often overlooked: daily hygiene. As we age, our skin becomes more sensitive, and our immune systems don't work quite as fast as they used to. That's why it's even more important to keep this area clean, dry, and healthy. Think of it just like brushing your teeth. You do it every day to prevent problems later on. The same care should apply to your genital health. Washing your penis every day with warm water is essential. If you're uncircumcised, gently pull back the foreskin and clean underneath it. A buildup of a white, cheesy substance called smegma can occur under the foreskin. This isn't harmful at first, but if left uncleaned, it can lead to irritation, odor, or even infection. If you're circumcised, cleaning is still important. Sweat, bacteria, and urine droplets can gather in the area and cause skin issues if not properly cleaned. When washing, it's best to avoid strong soaps, scented gels, or harsh scrubbing. The skin in the genital area is delicate, and using strong products may cause dryness, itching, or a burning sensation. Choose a mild, fragrance-free soap if needed, or even just warm water for regular cleansing. Take your time, be gentle, and treat it like the sensitive area it is. Drying the area properly is just as important as washing it. After your shower or bath, use a soft towel and pat, not rub, the area dry. Moisture left behind can become a breeding ground for bacteria or fungus, especially in warm areas like the groin. If you're overweight or have folds of skin, make sure to gently lift and dry those areas as well. Changing your underwear daily is another basic but vital step in hygiene. Choose breathable cotton fabrics that allow air to circulate. Tight or synthetic underwear can trap sweat and heat, leading to irritation or fungal infections. If you experience itching, redness, or a rash, it could be from poor ventilation or even a detergent sensitivity. Don't ignore it and consider speaking with your doctor if it persists. Also, take a moment during hygiene routines to check for anything unusual, like bumps, redness, sores, or discharge. These can be early signs of an infection, inflammation, or another condition that needs attention. At your age, catching something early often means faster, easier treatment. In short, maintaining daily hygiene isn't just about staying clean. It's about protecting yourself from discomfort, infection, and other avoidable issues. It takes only a few minutes each day, but makes a big difference in how you feel and how your body functions. You've taken care of yourself this far. This is just another simple habit to support your continued well-being. One of the most important things you can do for your penis health, especially as you get older, is to stay aware of any changes in how it looks or feels. This doesn't mean you need to examine yourself obsessively. It simply means paying gentle, regular attention to your body so that if something new or unusual appears, you can catch it early. As we age, the risk of certain conditions, such as infections, skin disorders, or even cancers, increases slightly. But here's the good news. Most problems start with small, visible signs. That's why regular self-checks, just like you might do with your skin or teeth, are such a smart habit to develop. What kind of changes should you look out for? For starters, keep an eye out for any new bumps, lumps, or sores on the skin of your penis, scrotum, or groin area. These could be signs of an infection, irritation, or something more serious like penile or skin cancer. If you notice something that wasn't there before, and it doesn't go away in a few days or gets worse, don't ignore it. Let your doctor take a look. Often it's something minor, but peace of mind is worth it. Also watch for any unusual discharge, a strong or bad smell, or changes in how often you urinate. Pain, burning, or a feeling of urgency when urinating can be early signs of a urinary tract infection or prostate issue. Some men also notice redness, swelling, or areas of the skin that feel different to the touch. These are worth paying attention to. Changes in color, sensitivity, or function are also important. If the skin becomes overly dry, shiny, or discolored, it may be reacting to irritation or a skin condition like lichen sclerosus, which can happen in older men. If you're having more trouble getting or maintaining an erection, that could be linked to your blood circulation, medications, or even early signs of diabetes or heart disease. These symptoms aren't always about the penis itself. They can tell us what's going on in the whole body. Many men feel uncomfortable talking about these topics, but your doctor has heard it all before. These symptoms are common, and they are far easier to treat when addressed early. You're not being a burden, you're being proactive and wise. You don't have to check yourself every day, but doing a quick once-over a couple of times a week, during your hygiene routine, for example, can go a long way in protecting your health. Remember, your body often sends quiet signals before anything serious develops. Listening to those signals is one of the most respectful things you can do for yourself. When we talk about penis health in men over 60, we absolutely must talk about the prostate. The prostate is a small walnut-sized gland located just below the bladder. It plays a big role in male reproductive health by helping produce semen. But as you get older, the prostate often begins to change, and sometimes it causes problems that can directly affect your urinary and sexual health. One of the most common issues is an enlarged prostate, also known as benign prostatic hyperplasia, BPH. This condition isn't cancer, but it can still be very uncomfortable. You might notice symptoms like needing to urinate more often, especially at night, a weak urine stream, or feeling like your bladder isn't fully empty after going. These changes can slowly become part of your daily life if you're not paying attention. But they're not something you have to just live with. They're treatable, especially when caught early. Another important concern is prostate cancer, which is one of the most common cancers in men, particularly over the age of 60. The good news is that if prostate cancer is found early, it's often highly treatable and slow-growing. That's why regular screenings, such as the PSA blood test, prostate-specific antigen, are so important. Depending on your personal and family medical history, your doctor may recommend starting regular screenings around age 55 or earlier. You may be wondering, how do I know if I have a prostate issue? Unfortunately, prostate problems often develop quietly. Many men don't feel any pain or discomfort at first. That's why keeping up with routine checkups and discussing any urinary or sexual changes with your doctor is essential. Don't be shy. It's a common topic in men's health clinics, and your doctor will appreciate your openness. Taking care of your overall health can also support your prostate. Eating a healthy diet rich in vegetables, fruits, and whole grains, particularly foods like tomatoes, broccoli, and fatty fish, has been shown to support prostate health. Staying physically active, managing your weight, and avoiding smoking all contribute to a healthier prostate and lower your risk of complications. If you're experiencing symptoms such as frequent urination, sudden urgency, difficulty starting to urinate, or pain in your lower back or pelvic area, don't delay seeking medical advice. It may be something minor, but even minor issues can affect your quality of life and lead to bigger problems if ignored. Remember, your prostate is a small gland, but it has a big impact on how comfortably you live. Regular screening, a healthy lifestyle, and clear communication with your healthcare provider are the best steps you can take to stay ahead. You're not just taking care of your prostate, you're taking care of your peace of mind. One of the most common concerns for men over 60 is changes in erectile function. It's something many don't like to talk about, but it's a completely normal part of aging, and more importantly, it's manageable. Erections depend heavily on healthy blood flow, nerve function, and hormone balance. When any of these are affected, changes in erection quality can occur. You might notice that erections aren't as firm as they once were, or that they don't last as long. Some men have trouble achieving an erection at all, or they experience less interest in sexual activity. These changes can feel frustrating, even embarrassing, but they don't mean you've lost your manhood. What they do mean is that your body may need a little extra support to keep things functioning well. Erectile function is closely tied to blood circulation. The penis relies on strong, steady blood flow to maintain an erection. That's why conditions like high blood pressure, high cholesterol, diabetes, and heart disease can all impact sexual function. These conditions can narrow or damage the blood vessels that supply the penis, making it harder to get or maintain an erection. Even certain medications, such as those for blood pressure or depression, may affect performance, One of the best things you can do to support your erections is to take care of your heart and blood vessels. Regular, gentle physical activity, like walking, swimming, or stretching, can help improve blood flow throughout your body, including to your genitals. Eating a heart-healthy diet low in processed foods and rich in fruits, vegetables, and healthy fats also supports circulation and hormone balance. You might be surprised to learn that mental health plays a big role too. Stress, anxiety, and feelings of inadequacy can affect sexual performance. Many men feel pressure to perform like they used to, which only adds to the tension. Give yourself permission to be honest about these feelings. Sometimes simply talking with your partner or a healthcare provider can take a big weight off your shoulders. If you're struggling with erectile issues, know that help is available. Urologists like myself work with men every day to improve sexual health. Treatments range from simple lifestyle changes to medications like Viagra or Cialis, vacuum devices, and even non-surgical therapies that enhance blood flow. There's no one-size-fits-all approach, but there are safe and effective options for almost every man. You deserve to feel confident, connected, and comfortable in your own body. Managing your erection health isn't about chasing your younger self. It's about staying engaged in life and relationships in a way that's meaningful to you. Addressing these changes with kindness and action can greatly improve your overall well-being, both physically and emotionally. When we think about penis health, blood sugar and blood pressure might not be the first things that come to mind, but they play a major role, especially for men over 60. That's because both high blood sugar and high blood pressure can damage the small blood vessels and nerves that are essential for healthy sexual and urinary function. Let's start with blood sugar. If you have diabetes or even prediabetes, it means your body struggles to manage sugar levels in the bloodstream. Over time, high blood sugar can damage the nerves responsible for sensation and the blood vessels that carry oxygen and nutrients to your penis. This condition, called diabetic neuropathy, can lead to reduced sensitivity, difficulty achieving an erection, and even problems with bladder control. Many men with diabetes also experience erectile dysfunction, ED. This happens because the fine blood vessels in the penis are very sensitive to changes in circulation. Think of it like your garden hose. If it becomes clogged or damaged, the water can't flow properly. That's similar to what happens in the body when high sugar levels are left unchecked. The good news? With proper management, these effects can often be reduced or even prevented. Now let's talk about blood pressure. High blood pressure, hypertension, puts strain on the arteries, including the ones that supply the pelvic region. If those vessels are stiff, narrowed, or damaged, blood flow to the penis decreases, making it harder to get or maintain an erection. Over time, high blood pressure can also weaken the muscles that help control urination. Many medications for high blood pressure are necessary and often life-saving, but some can affect sexual performance. If you suspect your medications are interfering with your sexual function, don't stop taking them. Instead, talk with your doctor about options. There are often alternatives that can better support both your heart and your quality of life. The best way to protect your penis from the effects of high blood sugar and blood pressure is through regular monitoring and lifestyle care. Keep up with your checkups, take medications as prescribed, and focus on a healthy routine. That means choosing more vegetables, lean proteins, and whole grains, limiting salty, fried, or sugary foods, and staying active with something as simple as a daily walk. It's also important to stay hydrated, manage stress, and avoid smoking. Smoking in particular is a major risk factor for erectile problems and poor circulation. If you ever feel confused or discouraged by the numbers on your blood pressure cuff or glucose monitor, don't be afraid to ask for guidance. Your healthcare team is there to help, not judge. In short, your penis is like a barometer for your overall health. By keeping your blood sugar and pressure in check, you're not only protecting your sexual wellness, you're caring for your heart, kidneys, brain, and more. It's all connected, and every small, steady step you take makes a big difference in how well you live. Staying sexually active as you age is not only possible, it's healthy, both physically and emotionally. Many men over 60 still enjoy intimacy, whether through partnered sex or solo activity. But as your body changes, so should your approach. The key is to keep things safe, comfortable, and adapted to where you are in life now, not where you were at 30. Let's begin with the most important point. There's no age limit on sexual health. In fact, sexual activity, when it feels good and isn't forced, can improve mood, reduce stress, help with sleep, and even support your immune system. It's a part of total well-being. But as we age, a few things naturally shift. Erections may take longer, sensitivity may decrease, or you may notice changes in stamina or desire. All of this is completely normal. The goal isn't to chase performance, it's to prioritize connection, comfort, and confidence. That might mean using more foreplay, adjusting positions, or using lubricants to avoid discomfort. If you're experiencing dryness, irritation, or reduced sensation, these are signs your body is simply asking for a little extra support, not that anything is wrong with you. Over-the-counter lubricants, both water-based and silicone-based, can help prevent friction and make intimacy much more pleasant. Another aspect of staying sexually active is being safe. If you're in a new relationship or have more than one partner, using protection like condoms is still important, even later in life. Sexually transmitted infections, STIs, don't disappear with age. In fact, rates of STIs among seniors have been rising in recent years due to increased social activity and decreased condom use. Having open, respectful conversations with your partner about sexual health is a sign of maturity and care, not discomfort. If you're married or in a long-term relationship, changes in sexual activity can still occur. Talk to your partner about your needs and any concerns. Emotional intimacy is just as important as physical connection, especially as bodies change. This is a time in life when tenderness, trust, and communication matter most. Solo sexual activity, or masturbation, is also healthy and completely normal at any age. It helps with circulation, relieves stress, and allows you to stay connected to your body. It's nothing to be ashamed of. In fact, it's one of the easiest ways to maintain sexual health and function, especially if you're not currently sexually active with a partner. Lastly, don't be afraid to seek professional guidance. Urologists and sexual health specialists are here to help you enjoy this part of life without pain, worry, or confusion. Whether it's difficulty with erections, pain during sex, or changes in desire, there are treatments and support options available that can make a real difference. You deserve a fulfilling, joyful life, including intimacy, in whatever form feels right for you. Staying sexually active, safely, and comfortably is about honoring your needs, your health, and your happiness. Your health isn't just about living longer, it's about living better. So if this video gave you clarity, reassurance, or even just a little peace of mind, please give it a thumbs up and share it with someone who might need this conversation too. And don't forget to subscribe. We're here to support you, one step at a time, with expert care and genuine understanding. Your wellness journey is worth it, and you're never too old to tay.